And just a minute on the radio. We've got Dr. Bob Williams with us, and just give us a minute just to talk about this, because Dr. Bob, you gave us an amazing statistic on breast cancer. What is that statistic?
1 out of every 8 women will get breast cancer.
What do we need to do to fix this problem?
Well, the first thing we need to do is to be able to cure it, and the best way to cure it is to find it early. It is almost always curable when it's found at its earliest stages. It can be 99% curable, but we have to find it early.
99% curable if it's found early. How do you find it early?
Find it early by getting a mammogram every single year after the age of 40.
Now, recently there's been a study that's come out that says something about after the age of 50. What about that?
The study quoted talked about the fact that you're more likely to get breast cancer if you're over the age of 50, and that's true. But 20% of breast cancers are found in women under the age of 50. So getting a mammogram does cause anxiety. It is scary. It is uncomfortable. But it does find breast cancers. That same study that said, maybe we can avoid that, also said that if we avoid it, we're going to have women die of breast cancer under the age of 50 because we're not getting mammograms. So anxiety, death, I want the women I care about to be anxious and get their mammograms and be cured of breast cancer.
Why do women not get mammograms?
There are a lot of reasons why women don't get mammograms. The first reason is that they may not be able to afford it, and it's important to be able to fund mammograms for women who can't afford it. We've given almost $500,000 away from Komen in this area to fund mammograms for women who can't afford them, and that's been a big improvement, and we want to keep doing that. But what's equally, if not more tragic, is the women who can afford mammograms, who are insured, who don't get mammograms.
So education and awareness is not enough?
No, not at all. If we just have education and awareness without action, without a change in behavior, without getting mammograms, we then have educated, aware women dying of breast cancer.
The women who say, I don't have time, I work, I have kids, I have soccer, I have football games, I have dinner. When do I find time to get a mammogram?
That's a hard question, and I'm not going to be able to be the one to answer it. I know that I want those women to be here with me, and I want them to get a mammogram, and the women I care about, I push to get a mammogram, because yes, those things are important, and yes, women take care of their families and their jobs and all the other tremendous responsibilities that they have, but a responsibility that I have is to make sure that the women I care about get mammograms, because I want them to be here with me.
How quick and easy is this process?
It can be very quick. You can drive up to a lot of mammography centers and get out of your car, go in and get your mammogram and be done with it. It's not necessarily easy. A mammogram's uncomfortable. It would be silly for me to say it's not uncomfortable, and some people it's more uncomfortable than for others. Robin might be able to address some other things that are uncomfortable. I understand that sometimes women's shoes are uncomfortable and their britches are uncomfortable and things like that, but doggone it, we want you here, so please go get your mammogram.
It's no more uncomfortable than wearing a pair of high heels for the day. If they find cancer, and that's what a lot of women are afraid of, is finding something, they automatically think they're going to lose their breasts.
That's not correct. And when we find it at stage 0, at the earliest stages, it can be cured with just a lumpectomy. That's just a small incision to take a lump out, and that can cure the breast cancer.
What if I don't have a history of breast cancer in my family?
Well, a lot of people think that if they don't have a family history, they don't have to worry about it. That 1 in 8 statistic is for women who don't have a family history. That means if you're in a room with 7 other women, 1 of you all will get breast cancer.
So one of the exciting things for us is that Jason Aldean, country music superstar, is coming in concert to Roanoke, and he is teamed up with the Komen Foundation to bring awareness, education, and provide action, hopefully, from the ladies who attend this concert.
Yeah, this concert is going to be huge in this area. It's not only going to raise money, and as we talked about earlier, it's not about education awareness, but he is going to be able to have an impact in decreasing the rate of breast cancer in this area. There are going to be women who will get mammograms who could not get mammograms before. 1, because maybe they couldn't afford it, but 2, because they didn't change their action, and he's making a big difference to get women to change their behavior and get mammograms, and for guys to talk to the women they love and care about, so that they can know that they'll get their mammograms. If your mother, your daughter, your girlfriend, your wife, get them to get a mammogram.
We appreciate your passion for the cause, but it's really our passion, and I hope that this little segment on the radio is going to get people to take action and get women to get mammograms.
Absolutely. If you're over 40 years of age, get your mammogram every single year. Get your provider to do an exam on you every single year. And if your mom, your sister, your girlfriend, your wife is in that category. Get them and hold them accountable so that they get a mammogram every single year.
Dr. Bob Williams needs to leave so that he can go to surgery. So he came to be on the radio with us, and so we want to make sure that you get to your surgery. So thank you for coming in, man, and let's hope we can make a difference.
Well, thank you. You are making a difference, and we very much appreciate it.
Not trying to be preachy, but ladies, we love you.
Get your mammogram.
We want you here. Get your mammogram.
Every morning.